My name is Matisse Ventura Bruer. I'm the Director of Racial and Gender Equity Advancement at YWCA South Florida, and I am very excited to introduce our panel discussion. This week, as part of Stand Against Racism Challenge, is understanding reproductive justice. So as part of that, what we really wanted to do was put together a forum for some of our experts and people to talk about what this means, how it really pertains to us here in Florida, how we can get involved. So thank you for tuning in. I'm going to introduce our guests, and then they're going to introduce themselves. So we have with us today Monica Skoko and Natalie Robinson Bruner.
Hi, everybody. My name is Monica, and I'm really happy to be here. Really happy that YWCA took an entire week to talk about this important topic. I am a nurse and a researcher, first and foremost, and also an advocate and organizer. I'm the executive director of the county's Commission for Women. And my job there is to make policy recommendations along with a board of appointees that will improve the status of women in Miami-Dade County. And I'm just really happy to be here. Thanks for having me.
Hello, everybody. My name is Natalie Robinson Bruner. I am the now founder and CEO of Glad at Leadership Solutions for a very long time, with Matisse at the YWCA, as well as a doc student in educational leadership, really focusing on a little bit of critical race theory. And so it's a pleasure to be here with you all today.
Thank you both so much for being here once again. And I just want to highlight our Stand Against Racism Challenge. Our presenting sponsor is Football Unites by a program of the Miami Dolphins. We have a lot of really great sponsors and a lot of really great materials we're really excited about. So we're in our third week. We've got our final week coming up next week, and we really just want to close out strong. So we're going to get into some of the topics around, or some of the details, I guess, around reproductive justice. And I want to reiterate to anyone who maybe isn't familiar with the challenge, our challenge is really about educating and creating a common language and an opportunity and a space for us to have these kinds of conversations, not a moral debate or a ethics kind of question of whether things should or should not be. They are. Currently how we're looking at how things are, what the status of the laws around reproductive rights are in this country, and what happens when a person doesn't have access, how that looks. So just to jump into kind of some of our conversation topics here, to open it up, I want to ask both of you, what does reproductive justice mean to you, and how do you define it, and who is it for?
You want to go for it?
You can go ahead.
Okay, well, I think for me, reproductive justice picks up where reproductive rights really leaves off and leaves a lot to be desired. And I think it's not just a change in semantics, but a real change in mindset. So it is a more all-encompassing way of thinking about humans and human rights and what we should be advocating for. So in reproductive rights, there's a lot of talk about access to abortion, access to contraceptive care, but in reproductive justice, we are talking about dismantling medical systems that are held up on racism. We are talking about dismantling systems outside of medical care that are not allowing proper medical care. We're talking about addressing the maternal health crisis and violence against women and trans folks. We're talking about making every step we can as communities, as governments, as advocates to make people or help people live the healthiest lives they can in a very holistic way. And that includes reproductive rights.
So I think you're hitting the nail on the head, Monica, that we sometimes narrowly define it by just one aspect of it, and where it's really about all the things that are surround reproduction. And so there's the physical aspect of whether you choose or don't choose to have children, whether the health systems around that allows you to make that choice. But it's also once you've made that choice or decided not to make that choice, what happens next? And so there's, is there childcare for people that have made that choice? What happens to children once they've been brought into the world? And so there are a lot of factors that go into making that choice when it comes to reproduction and being able to reproduce, that I think we don't even talk about. When we talk about people not being able to reproduce and the justice around that, I mean, there's like a lot of pieces that are really going into this. How safe is it? We talked about the medical care, and for Black women here in the U.S., it's just not a safe place to have children. And that, for being the level of cost that we put into healthcare, that should not be the case. And so there are a lot of things that go into making reproductive rights just, which means that it is fair and not necessarily equitable, but there is a certain level of ensuring that everyone gets what they need, and that the systems that keep people from getting what they need are taken down and broken down and dismantled. And so there's a lot that needs to happen. And I don't think people talk about it enough and understand all the issues around it to be able to really have an in-depth conversation about it. And so there's a lot to unpack. As I'm talking, it's just coming out like,
yeah, I think people think
vomit.
that if Roe v. Wade were codified, that reproductive rights would be won, and it like, good job, pack it up, we're done. And it's just so much more complex than that. It's like there was a story now almost a decade ago about this Black mother who made the choice. She had to go to work, and she worked at a fast food chain, and she had a 9-year-old daughter. And so there was a park a block away from her work, and she said, just go play at the park. There's parents there. Hang out at the park while I'm working at McDonald's. And her one of the moms at the park ended up calling the police, and that child was placed in foster care. And so that case is reproductive justice. So it's not just what's happening before, it's not access to contraception, it's all of it. It really is all of it.
So really what I'm hearing you both say is it is impossible to pull apart reproductive justice with racial justice, with gender justice, and that all of these things are economic justice too. They're all factors in why this particular person had to make this choice, that really that speaks to a lack of support and a lack of options that. And I mean, it speaks to a lot of additional questions, right? Around, I don't think we have the time to get into the foster system. All I would like to say is I would love to see the resources that there are definitely times where a child might be needing to be taken out of a home, but I would love to see the resources that the foster parents or foster places might get, turned back to the parents. We want to keep kids in their homes, right? But so anyway, that's a whole, I mean, it's not really a separate conversation, but I don't know if we have time to get into that today. But I really appreciate both of you speaking to that it is much bigger than just women's issues, right? I think we leave a lot of people out when we reduce it to that. And we leave, it's so oversimplified, and that really leads into my next kind of question that I would like, to hear y'all's opinion on. speaking of kind of the polarizing nature of abortion, which is what is more talked about than probably any other issue we might consider to be reproductive justice. In light of, just a few days ago, the governor of Florida signed House Bill 5, I believe it's called, basically the 15-week abortion ban. And given that abortion is just a part of reproductive justice, how do you both feel, how does that fit into the conversation? How timely is this? How, really just what are your thoughts? What would you like to put in people's ears at this time?
So I think this is clearly unbelievably timely. I'm pretty sure you didn't know the governor was going to do this when you guys planned this out for this particular week. But it is, I think, a myopic view of the issue. And it, how do I say this nicely? I'm always looking for my words. How do you really just look at one aspect of it and not look at the entire culture, the people that are impacted, and not step back and say, here are a slew of things that I need to do, and then tout it as a win? And so that's my big thing, is that for it or against it, it doesn't solve anything. And so I would just love for people to sit down and have an honest conversation, to start to understand where people are coming from, to understand that you can disagree with somebody and not be against someone. And I think they've made it to a point where it's become a stake on morals and values and who you are as an individual, as opposed to we can just have a difference of opinion when it comes to something. And when it comes to this, we can have differences of opinion. That doesn't change that there are 50 million other things that we need as a society. And so let's have a difference of opinion, for, against it, and let's focus on all the things that we need to do.
Yeah, exactly. And just allowing healthcare providers to do their work, informing people of their rights to know about this medical procedure, because that's what it is, right? It's stigmatized, it's all of this stuff, but it's a medical procedure. And as a patient, you should be able to know about your rights to an abortion. And I think it is government overreach to be quelling these rights against abortion. And I completely agree with Natalie on all of the fronts that she mentioned. And it's impossible to forget or ignore the fact that these laws in Florida, Oklahoma, every other state that's passing them, they're not affecting me. They look at my apartment. I live in a lovely apartment downtown. I travel all the time. They are affecting poor Black and brown folks. That's who they are affecting. That's who they are going to affect. As a nurse, or a former nurse from Planned Parenthood, I saw so many clients and patients, and a lot of people, the question you get is 15 weeks is so long. They should have had time to figure it out by then. But 6 weeks is the bare minimum. You're going to figure it out that you're pregnant. And then you have to get your ducks in a row, right? And then you have to get funding. They're not cheap. They're not cheap at all, because there's so many bans on how funding can be used, state funding. And then you have to schedule it. And there are so few clinics, so few doctors that are able to perform these procedures. So then you start to really understand how the weeks add up, right?
Well, that's a great point. Go ahead,
And
Matisse.
yeah, I mean, Monica, as a former nurse, especially having worked, with Planned Parenthood, how much I've, in my limited understanding and research into the phenomenon, it seems when people have this ability to to view their issues as, something is crazy happening in my life, like I can't believe this happened to me, where I'm needing to make this choice. But when someone else does it, well, they made the wrong choices, or they, whatever, people will excuse and they will rationalize a decision they may be morally opposed to, but not, and they'll excuse it for themselves, but they won't excuse it for others. They won't extend that same compassion. And I wonder, if you could speak to that phenomenon at all.
Yeah, I mean, I think that's simply a part of being human. And I think it really needs to be left up to healthcare providers and the patient. I think that we have a long way to go to taking away bias from healthcare. And that's really my niche right now in trying to work on that and making sure that we're very person-centered in our care moving forward. And but yeah, I agree with you. Adding compassion back into service and human-centered service is key. And adding compassion into this conversation. There's a lot of evidence that deep canvassing or knocking door to door and having long conversations, 20 to 30 minute conversations with folks can potentially change their mind. Maybe not going from one extreme to the next, but really kind of changing their point of view a little bit, at least, on this topic and other similarly difficult topics. So I really think having those deep, long conversations really goes a long way.
And I think that's the next step after you sort of have compassion. You need to sort of educate yourself so that you can then have empathy for people. And I think we don't stop and learn, which is why, I love the 21-day challenge. I've really been enjoying it. To stop and sort of learn more about these different topics. And then, like you said, sitting down, having these conversations so that you can have that different perspective that you talked about, Matisse. A lot of times individuals see their worldview as the worldview, as opposed to it's a worldview. And there are different stories that people need to educate themselves on to understand how these laws, how these systems impact other people. Unfortunately, things that are helpful to some people aren't helpful to all people. And so they need to stop and recognize that and really think about the impact of some of their decisions, and just to be able to take that into consideration when they're making these decisions. And I don't think that's happening as much as it should.
I think you're right, Natalie. I do think there's an aspect of people wanting to police their neighbors, people wanting to control other people's decisions. And what Monica said earlier is, I think you both really said it, where we don't have to agree. You don't have to choose it for yourself. You don't have to like it. But we can't, it's not our job. You don't have to like, what your neighbor does. Everything's different for everybody. And I especially think it harkens back to the nature of justice. And justice is about correcting a wrong or people getting what they deserve. And I think, kind of in the United States culture, as I experience it, we focus too much on guilt and blame, and who, well, they're successful because they worked hard, and they're poor because they didn't. And we need to step back and look at the systemic issues, especially what Monica said earlier, of how these laws are not necessarily going to impact her. And there historically have always been ways for people to access an abortion if they want it, if they are of a certain, if they already have access to other things. If people have money, that opens a lot of doors. You can go out of state to where you can access. So, I mean, anyway, before I get too deep into that, I want to ask how you think that, justice really fits into health overall, since reproductive justice is health. We're talking about health. We're talking about a social justice issue. And I think there's a lot of overlap there. And I'd like to hear what y'all think about that.
So I think justice and health, unfortunately, haven't had the overlap that they've needed for a very long time, especially in this country, and especially for certain groups of people. From the actual administration and access of it, the care given, all the way to the determinants of what is healthy. There are just so many layers and levels that need to be addressed to truly talk about justice in health, that it feels almost daunting at times, because there's just so much that needs to be done. We're so far behind. We're arguing about even moving forward on these things, and there's just so much thing. And the problem is that there are individuals caught up in the midst of it that aren't receiving the care, that are getting sick, and that are passing away because of these injustices that are happening within our healthcare on these different levels. And I think it just takes individuals that are ready to take up the mantle, like Monica, and really fight for what needs to be done on all these different levels when it comes to having justice within our healthcare system.
And I think one of the first steps is making everybody well aware of it, making everybody see it not as this amorphous concept. I think everybody's at this point in 2022, they realize, racism exists, and we still don't see ourselves as part of the problem. So one of my favorite / least favorite studies I've ever read is about inherent biases in doctors when treating Black patients, and astounding percentages of doctors think Black people experience pain differently and therefore treat Black people with pain differently, which is notable because one of the most painful conditions a person can experience is endemic in a Black community, sickle cell disease. They believe many Black patients have drug-seeking behaviors, and they believe Black people have thicker skin for some reason, like just egregious lies that have been passed by generation to generation. And that's who we are seeking care from. That's how could you possibly expect high levels of care when you are Black, Indigenous, living in a fat body, whatever it is, when your providers hold these biases. So we need to train all of our providers to treat people with respect and to treat people like people.
And Monica, like, you're so spot on. And I saw this when I was working in the School of Medicine, of individuals where how much training they get when it comes to understanding about the patient that they're going to actually be serving one day, and their culture, and understanding who they are as individuals. So just to tell a really quick story, I actually had a blood clot, DVT, in my right leg. Like, they said it was so massive they hadn't seen that size before. Went to 4 doctors, 2 different hospitals, and nobody diagnosed it until I went to an orthopedic surgeon who said, let me try this one thing. And during this time, I'm flying around the country because I'm thinking there's nothing wrong with me. Yeah, I know. I'm still here, so it's okay. But the mere fact that it took all these healthcare providers who did not stop and think about, here is something that could be a problem, and actually start to figure out and diagnose it to the point where it didn't get as far as it needed to go. So.
And even zooming out, I'm so sorry you went through that experience. Zooming out to general gender justice from trans folks seeking care, and I would say probably avoiding care, because you can't just walk into an office and say like, hey, I'm trans, hope you're okay with that. You know what I mean? That could literally have that could endanger you as a person. So when we see all of these this data about lower health outcomes for fat folks, for trans folks, for indigenous folks? Is it really anything about them, or is it about the biases that they run into, right? And as women, we know that our pain is not taken seriously. We know that when we have serious reproductive issues, there's a lot of take a Midol and see in the morning, and you could be hemorrhaging. And that's frightening. Your story is frightening.
And I think we don't stop and think about, there's almost this reciprocal nature of it where we aren't getting the healthcare that we need, and it causes us stress. And then the stress causes us to have poor health. And so it's like this back and forth sort of thing that's only a downward spiral that's making things a lot worse. And instead of stopping the spiral, I was trying to think about something positive they were doing. I can't think of anything positive. Monica, help me. That's being done. My brain just didn't go there for a second. I need some support on that.
In specific to Miami-Dade, I think there are some really cool groups doing great work. Dr. Armin Henderson is doing some really cool work on the Idea Exchange. So Dr. Henderson is specifically focused on houseless populations in Miami and making sure they're getting the care they need. And the Idea Exchange is focused on harm reduction, which is essential tenet of reproductive justice as well. So rather than a paternalistic view of medicine or care, saying, you come to the doctor and the doctor says, this is what you need to do, go forth and do it. You make a plan of care with your provider. You have a say, you have an equal say. Can you imagine having an appointment like that? So the Idea Exchange is really about harm reduction, providing clean needles, things like that, and testing for STIs, HIV, and I think they're doing great work.
And before we leave this topic, Monica, you mentioned the barriers to trans folk, seeking care, and I wanted to speak to that, personally, and to say the level of, and I think it overlaps a lot with the, living in a fat body or being a person of color, where it's doctors are somehow, or providers are somehow allowed to say, well, I don't know anything about, like, go somewhere else. I don't even know. And a lot of the conditions or a lot of the reasons people might go to the doctor might have nothing or little to do with being trans or being fat or being whatever, but doctors see this, they see you, or they see your chart, or whatever it is, and that a wall goes up, and all of a sudden everything must go back to that, rather than actually sitting down and looking at the person. And I think a lot of my personal thing is, like, gender markers don't really need to be on a lot of our documentation. They don't necessarily, you need to know what services I need, right? That maybe you need to know what kind of parts I have, and you can ask me that, but you're not going to get that from a letter. That's not going to tell you the full story. So I think, going back to treating people as individuals and trying to determine what you actually need as an individual is where we need to start. And before we leave,
we live in this day and age that the internet can be such a resource, especially for marginalized folks, trans communities, fat communities. There are tons of message boards and things like that share, like, hey, I live in South Florida and I saw this provider and they were super down with trans care. So or on the polar opposite, I saw this provider and they were awful, don't go. So I think that's a really good way to make sure that you're safe and receiving care. And I think that's a good resource.
Yeah, we're very fortunate, I think, here in South Florida to have a lot of providers who specifically, try to outreach into the community. And before we leave the topic of medical disparities, I wanted to make sure, I literally just saw the presentation from Hispanic Unity Florida earlier, and one of the things they highlighted was the just insane disparity in infant mortality rates among. There's definitely disparity between white and Hispanic people, but the one between Black people and everyone else was just like insane. And the fact that I was in a room with highly educated people who have been working in the social justice kind of sphere, and everyone knew this, but didn't necessarily know the factors, and the factors are many and they're systemic. And I just want to make sure we're continuing to talk about that at every level and every opportunity. So.
The Commission for Women, actually, every year we use data from the Status of Women report, which is commissioned by the Commission Auditor's Office within the county, but made by FIU's Metropolitan Center by Dr. Licheva. And this year, our recommendation included, the scope is a little limited, right? So the scope of the county commissioners over healthcare really extends over the Public Health Trust. So we recommended that the Public Health Trust meet and form a plan within 1 year to lower the rate of Black infant mortality to the rate of white mothers by over the next 5 years, because it truly is ridiculous. It is currently 3 times the rate. And like you said, there's really no explanation other than racism built into the system.
And so, Matisse, you probably do a much better job than I would at this, but because I know all 3 of us know what we're talking about when it comes to systemic racism and these systems that are sort of intertwined with each other that are causing all of these issues. But I don't think people really stop and think about how these systems are built on one another. And when one is sort of a little weak and faulty, that it impacts all the other systems. And so when we're talking about healthcare, yes, we're talking about healthcare access, quality of it, cost of it, all these things, but it's not just that aspect. Like Matisse said, it's the economic. Do you have health insurance at work? Do you have a job that provides it? Are you part-time and don't have that, and you have to pay out of pocket for a lot of things, where a hospital bill becomes between that or paying rent, and therefore you don't get the health care provided. And so it's all these systems that are kind of built on one another that's really sort of seeing all these numbers, this disparity. And so, yes, we can talk about let's improve the healthcare of it, but it's not just that. There are all these other broken systems that are upholding these horrible numbers and sort of bolstering these numbers that we're seeing when it comes to the disparities within health.
Yeah, even getting to engage with the healthcare system is a privilege. So many people say, oh my goodness, I could never have insurance. I could never have this. So I'll take my chances. And when something catastrophic happens, they go to the ER, they get a huge bill, they go into debt for the rest of their lives. And likely something is discovered that could have been prevented, and they have to go into treatment when they might have not had to. It is one of the saddest things in our country that just goes, it's just status quo at this point.
So I'm going to say being poor charges interest, exactly as Monica's just described. If you can't pay to get your teeth cleaned, so now a year later you pay to get a root canal. And I'm going to make a shameless plug for universal health care. I'm just going to go out and say it. That is my personal belief would solve not all of these problems, but it would put a dent in it. So that's my one spiel. And then, I guess that kind of leads us
to Natalie's point about the systemic problems. The AMA, the American Medical Association, is the reason we didn't get universal health care twice in America's history. So
tell me more about that.
So this is very early in America's history. Our current hospital system is a little over 100 years old. And as it started growing, the AMA was formed, and they correctly saw that if universal health care was passed, their doctors would make less money, like they do in most other countries, right? Doctors in Japan and other places, they make good money, but they can't charge what they do here. So they were protecting their doctors. And so we we did not get the chance to get universal health care.
So on that note, what if we want to get involved, if we want to make some change, right? Because this, I think we've clearly explored the fact that reproductive justice is not just a women's issue; it's an everybody issue. I don't know about you, but if you're a human being, you're involved, right? It's health, it's community, it's everything. So if we want to get involved, what can we do?
I think that's one of the exciting things. There are so many ways to plug in. Like, I personally know fair, affordable housing is a huge piece of the puzzle. It is not my piece. It is not the piece that gets me going every day. But I know so many advocates that's their piece. And I think that is incredible. And I think it's part of reproductive justice, right? If you have a safe, affordable place to live, that informs a lot of your decisions. I currently, since we're in a state of emergency, really, in Florida because of this abortion ban, I think a really easy way to get involved is supporting your local abortion funds, like Women's Emergency Network. Yeah, there's so many different ways to get involved. I think it's good to pinpoint what you are personally passionate about and going from there.
So I think that that's a good point, to find what gets you sort of engaged. And once you do, I say your time, your talent, and your treasure need to go towards that. So definitely taking some time out to volunteer, whatever resources that you have or skills that you're capable of, whatever giftings you have, to sort of lend it to that cause. And then if you have the resources available, to support organizations that are, again, wherever your heart is, to sort of support those organizations. And then, there's something that we can all do, vote, wink, wink, about who's not making some of these decisions within our municipalities, to help drive sort of what you feel, and take the time and let them know. Like, you can let them know how you feel about these issues. You don't have to be quiet. You can stand up and have a voice for the things that you believe in.
Yeah, I think being involved in government is a really good one. And, in a very nonpartisan way, just figuring out who supports best the ideas that you support, and you can talk to them. They aren't these huge figures. They are people who will work for you. You can go to your government meetings, you can just sit and listen, or you can use your voice. You can talk to them before and make a meeting with them. I think until 6 or so years ago, I didn't realize how participatory this process can and should be. And I think that's a huge step towards reproductive justice at the local level, state level, and federal level.
Definitely. And I think if you have other like-minded people that you feel the same way, getting them involved in sort of voicing their opinions. I actually worked in a couple of politicians' offices at one point, and we noticed when a group of people came in around an issue. So we stopped and we talked about it, and it brought our attention to it. So don't think that it doesn't have an impact, because it does.
And I would imagine also for people that have, their financial ability to do so, as Monica mentioned, there's always groups and funds you can donate to. Some of those resources, some of those are listed out in Stand Against Racism in our materials. We'll make sure to put it in the link of this, as well. And I really just wanted to thank you both so much for taking, an hour out of your busy lives to talk to me about this. And if there's anything left that you guys want to share before we go, I just really appreciate you taking the time.
Thank you so much for having us and hosting such a great conversation. I think a good takeaway is that reproductive justice isn't an objective with an endpoint. It's an ongoing practice that sets and center on a lot of just portions of human rights forgotten. I really just hope that after listening to this, some people feel energized to go out and even spend an hour of their week every week making a difference. And if anybody needs some outlets to do that, please just get in contact with me. On social media, I'm at Loco for Skoko. You can email me, DM me, whatever, and I'd be happy to help.
So I just want to say thank you both for having this conversation with me. Only thing I would say is keep learning, keep growing, taking the time to understand that if you're watching this, you're watching it for a reason. That means you're one of the people that are going to definitely do something great and where your heart's fire is. And so continue to go into that direction and, like I said, make the world a better place, because you can.
Thank you both. That was both just inspiring, uplifting, kind of the note we need to end on, hopeful, right? That we can do things together. So thank you both again so much. And I hope you both have a good evening and a great rest of your week.
Thank you, Matisse.
Thank you.
Bye.